humor consumers, to the Life Happens, Laugh Anyway podcast. I'm comedian Tracy DeGraff.
And I'm Cathrine, co-host and bestie.
You almost lost your microphone there.
Yeah, I just realized I didn't have it. So right at the last second, whoop,
grabbed it over.
Brought the boom over.
Yeah, welcome back to the Pod Lab, Cathrine.
Thank you.
We're slowly but surely making progress in here. We're going to get rid of these boom arms. They're going away.
I would love that because it makes me feel cross-eyed because I look at my computer or I look at you and I've got this
I know.
So, yeah.
I know. It's crazy.
Yeah.
So I know that our audience can't see it, but just trust me. They're these big arms that bring our microphones over and they swing and they're beautiful. They're great. But they're just, I don't know.
It's just awkward with this little pub table we have.
Yeah.
And I always feel cockeyed. And you know, that drives me crazy.
Cathrine is like Mr. Monk. She is just like Mr. Monk. If something's out of place, she's just like, ah.
Yeah. Yeah. Like when I said, I just feel cockeyed. The microphone needs to be here. And you're like, just move your seat over. I'm like, that's not the solution.
See, there we go again. Not planning on it, but we're off the rails and we just started.
Sorry, folks.
We're not sorry. You said that, but we're not really. We're just trying to get this done.
I'm sorry for the ones that it bothers.
They already left, Cathrine. They're not here anymore. They're like, these two idiots. I'm not listening to them.
Right out of the gate.
All right, friends, today we are talking about a very important topic, especially because we are recording this in October 2025, and it is Breast Cancer Awareness Month. I myself am a breast cancer survivor. Praise God for that. 9 years cancer-free as of now.
9 years.
I know. Doesn't it seem like it went by fast?
It absolutely does. Yes.
I think that's how it's going to be for the rest of our lives. Every decade just feels like a minute.
Yes, absolutely.
That's how it is.
Yeah.
So anyway, we're covering cancer screenings today. And so please stay tuned. Like, don't give up on us. Even if we bore you, I don't care. Just please listen because we have important things to say. And we love you. We just prayed for all of you.
Yeah.
We did. We pray every time before we start.
We do.
Believe it or not, we ask God to help us. We're like, please, we're messed up. But we prayed for each of you, and whoever is listening to our voices today, we prayed that, you know, if God has a message for you about your health, about your body, if there's cancer in you and you need to get it out, that you would get a screening and you know,
take care of it.
Take care of yourself. Yeah. All right, so before we get into our outline, which I have in front of me, Cathrine, tell our listeners how they can support us by sponsoring this podcast.
You can go to lifehappens.laughanywaypodcast.com, and then it'll bring you to Tracy's website, and from there you'll see right away a field that you could go to sponsor. And your sponsorship helps us a great deal with our platform, getting the material out. And we have bought new equipment, and hopefully you could tell the difference.
Yes,
it was a while ago, though.
Yeah, our microphones are nice.
Yeah.
Very nice.
Yeah. So, and just to move it forward, we just need your support.
Yeah, and we appreciate it. I mean, $5 a month might not seem like much, but it's everything to us. And I don't know, we have like around 30 sponsors right now that contribute regularly, and we really appreciate that. So thank you to all of you who are sponsoring, and tell your friends.
Yes.
So very good. All right. These are a couple things that we're going to cover today in this episode. I'm going to talk about my cancer story. We're going to go over why screenings matter. We're also going to talk about all of the different cancers that offer a screening, because not every cancer has a screening, sadly. We're going to talk about barriers and excuses, like why we procrastinate on screenings. And as always, we have a call to action and an inspirational close with some scripture to share. Mm-hmm. All right, so we're going to start with my cancer story.
Yeah.
As you know, bestie, because you've been there for me for 25 years. Mm-hmm. When I turned 50, I was diagnosed with breast cancer.
Yeah.
And it was a shock, you know?
I couldn't believe it.
Couldn't either.
I remember when you came over, and I knew immediately something was wrong, and you were crying. And I thought something was wrong, you know, with one of your boys. I thought something happened. Something happened, even though I knew you were waiting
to hear from the doctor.
I knew that. And I was so shocked, Tracy. I really was shocked when you said that.
I think that for anybody who's been diagnosed with cancer, when you hear those words, you have cancer, it is a shock because those are words that other people hear.
Yeah.
You know?
Right.
You just don't, because cancer, you don't feel bad. It's not like you broke a
Yeah,
bone
right.
or you have swelling or you
Yeah.
have a headache. You don't have any feeling of anything really.
Yeah.
At least what I had.
Yeah.
And
right.
at my stage, other cancers, you might have pain or something.
Yeah, I've heard a few people be really, really like fatigued.
Yeah.
Like unusually tired, but
Yeah.
other than that, yeah.
Yeah, so it's a shock, and you never want to hear those words, and you don't, and trust me, it's hard to tell somebody that you care about and that cares about you that you have it, because you know that you're all going on the road together.
Yeah.
And that's how cancer is. You just take your family with you.
Yeah.
You know, and I don't think there's anybody whose life hasn't been touched by cancer in some way.
I'd be very, very surprised.
Right. And even myself, my mother had cancer and died of it when she was only 51. I was 27 when she passed away. So that was a really hard journey for our whole family. Mm-hmm. And so because of that, though, because I lost my mom when I was in my 20s, I had made a decision very early on that whenever I get old enough to have cancer screenings, I'm going to be faithful to get them done. Mm-hmm. And I did. So when I turned 40, I went for my annual mammogram, and I did it every year, for 10 years. And every year it was, okay, see you next year, every single year, until I turned 50, and then it was invasive ductal carcinoma was the diagnosis. I remember when the guy, what do they call him? The radiologist who was reading the test called me to give me the results. And this was a biopsy test.
Yeah.
So for anybody that doesn't know, this is kind of this was the road that I had. I don't know if it's everybody's story, but I went for a regular routine mammogram, and it showed something, but they couldn't confirm it. So then I went in for another thing, and I forget what it was, an MRI or something. And then I went in for the biopsy, where they go in there and they grab a little piece of that tumor and they pull it out to see the cells. And that's what confirmed, yes, it was invasive ductal carcinoma, because I guess the cells are they can tell under the microscope what they're looking at.
Right.
In my particular cancer was slow growing. I didn't know that breast cancer is more than one type of cancer. I had no idea. I thought it was all one.
Yeah, I didn't know until my friend, as you know, Tammy had it. And then there was another woman in our community who had it, but it was a very rare form. So it was around that time that I realized, oh, yeah, there's different ones. But
yeah, and they can have different kind of aggressiveness.
Yeah.
Well, my particular cancer was slow growing, and it wasn't super aggressive, and I was already 50 before they found it. And the doctor said, you could have had this growing in you for 10 years. It's that slow growing.
Yeah. You know that website I was telling you about before we went on?
Yeah.
They mentioned those slow growing ones in regards to their statistics, which is too complicated for me to share on the podcast, so I'm not going to.
Well, and then there are other types of breast cancer, especially I guess in younger women, that they can be extremely aggressive and life-threatening almost immediately. Yep. And you really have to hit them hard with whatever tools you have in your toolbox to get rid of them. So anyway, but we didn't know what type of cancer I had at that moment when I was coming over to your house to tell you, right? And I just, I was grateful that I was in the routine habit of going once a year for that mammogram. And I was grateful. And see, the cancer that my mom died from, it's called multiple myeloma. Yeah. Now, she died in 1993. Now, today in 2025, they have a lot more treatments for multiple myeloma than they did then. And my family took her to the Mayo Clinic for treatment because it was super rare. And the best doctor in the United States for that particular cancer was at the Mayo Clinic. And that's why she was treated there. And she lived for 4.5 years before she passed. And it was a very hard passing. She was in a lot of pain. She lost a lot of weight. It was a very hard disease. But I'm grateful that my takeaway from that experience was to do whatever I can. I can't I'm not going to live forever. I mean, obviously we know that.
Right.
But there was no screening for that cancer. So there's no way that you can know if you have it early.
Mm-hmm.
And the symptoms for it didn't really show up until it was already stage 3.
Yeah. Every time I hear you say what prompted you to get your screenings, I often think about what prompted me, and I as I think about it, I think it was just the fact that listened to, like, on the news, it would say do this, and then it just seemed like there were posters and information was everywhere. And so I just, I am going to obey, type thing. And so it was more like that, like, well, that sounds smart and wise. I better do it.
And it is smart and wise. And, I raised 5 children. My husband and I raised 5 boys. When they were born, you had a pediatrician that would give you, well, here, you're going to come in this month, and then you're going to come in this month.
Yeah, and you do it.
You do it. Mm-hmm. You check the boxes, you write it down.
Yeah.
And you don't miss it.
Right.
But when it comes to our own health, I know there's somebody out there listening who you do everything by the book for the kid, but where do you put yourself on your priority list, right? Mm-hmm. We could talk about that more under the procrastination part.
Yeah. Or might be doing for your senior parent.
Yeah.
And not yourself.
Yeah. I mean, women especially are very nurturing, very caregiving, except sometimes we sacrifice our own health for somebody else. Mm-hmm. So with that being said, don't skip your cancer screenings because they're that important. My disease was diagnosed at stage 1 because of a routine mammogram. Mm-hmm. And my breast surgeon was also a personal family friend of the DeGraff family, who I had known for many years, and he's a Christian man. And he told me, he said, breast cancer is nothing to mess around with. Mm-hmm. You definitely, it's like, I use a little metaphor of a bonfire. I felt like my cancer was like standing next to a bonfire. I could feel the heat, and it was destructive. I was diagnosed at stage 1, so I was next to it, but I wasn't in it.
Yeah.
And I feel like I'm grateful that the cancer didn't grow to stage 2 or 3 or 4, because then you're in the fire.
Yeah. And you were a little behind on your screening.
I was. Even though I was faithful to going every year, I had just started working at Southwest Airlines at Midway Airport, which I've talked about before on this podcast, and I have a little comedy bit about it. And they don't let you off. Like,
no.
Like you those planes have got to fly.
Yes.
Those people have places to go, and you got to be here to get them there.
And you were low on the totem pole.
I was. So I didn't have a way to get off to go get my mammogram.
Right.
And then I ended up quitting because 4 months was long enough for me. I couldn't remember my jokes. Yeah. I was like, this sucks. So I quit that job, and I'm kind of glad I did, because then I was like, okay, well, now I have all kinds of time to get my mammogram. So I was late, but I was only a couple months late.
Yeah.
And I was able to get it, and then my treatment was pretty easy. Yeah. I had a lumpectomy. I did not have to have a mastectomy.
Yeah.
It was an option. They did tell me that if I wanted to have a full mastectomy, I could, and then have reconstruction and all of that.
Yeah.
But for the small tumor that I had, and I do have like a little divot in my breast, like it almost looks like a pothole, Right. But I'm like, all right, whatever. It's just a reminder of God's grace to me. Mm-hmm. So that didn't bother me. And then I received radiation treatments for 3 weeks, where I had to go every day. And that was interesting to me. I was afraid of radiation at first because I was afraid of the radiation part of it. Right.
Yeah. I've seen Chernobyl.
Right.
Pretty scary.
We watched that movie. It was terrifying.
Yeah.
Well, I was afraid of it. So Ron and I went to Silver Cross Hospital here in New Lenox, Illinois. That's where I was treated. And it was the University of Chicago cancer treatment.
Right.
So it was coming from the city. Mm-hmm. But I went to this lecture where this guy was teaching just regular people. It wasn't like doctor training. Yeah. It was like patient training.
Yeah.
All about radiation. And when we walked out of there, I couldn't tell you exactly what he said. All I know is that I felt more confident.
Yeah.
And okay, so I was like, all right, they're doing everything physically possible to avoid zapping other parts.
Yes, right.
And my particular radiation treatment, I got to lay down in a, I like laying down. I always say that at workout. Can we lay down now?
I know. I love it when she gets the yoga mats out.
I know.
Time to lay down.
Nap time. Well, I laid in the prone position, so my breast fell through a hole, and gravity was like, yes, give me that breast. Down the hole it went, and they zapped me from underneath.
Yeah.
And your breasts have to be a certain size in order for that to work.
Oh, really?
Yes.
I did not know that. Oh, so bigger?
Yeah.
Okay, so I wouldn't be able to have that probably.
I don't know.
I did not know that part.
Yeah. And the
Wow.
the tumor has to be located in enough of an area away from your chest wall.
Yeah.
Because they're putting you in the prone position so that they can try to zap you from underneath in order to avoid radiating through your chest.
Right. Yeah.
And so they're not going to get your lungs or anything else,
Thank
right?
goodness.
Yeah.
Oof.
So anyway, yeah, I was fine. And getting into position, what they do is they create a mold of your body.
Yeah.
And it's like a hard plaster, I don't know, mold. They create a mold, and then you use that every day. And you come into the radiation area and you get into the mold, and you're totally, like no top on or
robe.
anything. Basically, no.
Yeah.
But you have your underwear on if we're going to just so
These poor people are creating a picture in their heads.
Stop. Just make it stop. But what they do is so fascinating. You get tattoos. So I have 3 tattoos on my back that are just little dots.
I'll bet you never thought you'd have tattoos.
No.
You're all tatted up.
No, but I got 3 tattoos, and it's just a tiny little dot.
Yeah.
And what they do is they have lasers that line up to the tattoos. This is how exact it is. Then they have 2 techs that wiggle you around based on sheets. Like the sheets are underneath you, and they tug at it just a little tiny bit. And then they make it, and they could spend maybe 20 minutes getting you in the right spot.
Wow.
And then it takes like 5 seconds for them to administer the radiation. And then you're done till the next day.
Yeah. Most of the time is just getting you into the
Position.
right position.
Yeah. Yeah. And then, there is some side effects to it in terms of there's some burning on the skin. It does not hurt or burn when you get the radiation, but they give you this cream that you're supposed to put on it every day, which I did. But the burning kind of comes from the inside out.
Yeah.
And so the skin cells are burned beneath the surface, which is weird. But once it kind of works its way out to the top of the surface of the body, it just heals like a regular burn.
Gosh, I can remember that of,
Tammy.
And I mean, she was burnt, really red.
Yeah. And I do not grow armpit hair under this arm ever.
I forgot about that.
I don't. So,
wow.
Yeah.
Yeah, radiation is powerful.
It is, but it has a job to do.
Yeah.
And so, I mean, there's always risk versus reward, right? When it comes to treatment.
All the time.
And I really trusted my surgeon. He's now retired, but his name was Dr. Danielson from New Lenox. And he was a highly respected surgeon and Christian.
Yeah.
So I really felt like I was in good hands. And he sent me to the, different doctors that I had to go to for radiology and for, all that stuff, oncology.
Yeah.
Yeah, so that's my story, and now I'm 9 years cancer-free, and I go every 6 months for a checkup, and you take me to my MRI ones because I have to take the Xanax because I can't do it. I cannot do it. Yep.
Yeah, you get the claustrophobia.
Oh, my goodness. I tried the first time that they sent me into that tube, and Catherine dropped me off, and pretty soon I come out, and she's like, what happened?
Yeah.
I said, I couldn't do it. And I was, like all upset.
Yeah, you and my mom. I remember when she couldn't do it either, and they actually they let me hold her hand.
I remember that.
While she was in the MRI tube, and I was stretched like for, I think it was 30 to 40 minutes.
Yeah.
It was not easy.
I wish somebody would come up with a better MRI because I hate that knocking. That.
Oh, yeah. Dum, dum, dum. Yeah.
seems so primitive.
It does. But it makes sense when you know what it is, the magnetic.
Doesn't make any sense to me at all.
Yeah.
All right, let's move on.
Yeah.
So that was my story, and I'm sticking to it. Now, let's move on to why do screenings matter, Catherine? What say you?
Well, they can lead to better health outcomes.
Like living?
Like living. Yeah, and it makes it possible when you go for routine screenings and checkups, it's possible to catch some developing cancers early when successful treatment is more likely. So you have more treatment options and less invasive treatments. And again, better chances for survival.
Yeah.
So.
Oh, I totally forgot to share the oncologist story that I was going to share.
Oh, yeah, that's right.
All right. Sorry, I'm taking the microphone over again. When I went to my very first oncology appointment. So, you have your surgeon and then you have a separate oncologist.
Right.
And I went into the office and the woman is, across from me. And this is just a consult. And she looks at me and she goes, our goal here is to give you 30 more years. And I was like, that's it? 30? That's all you got?
All right.
Like, you can't pull out something number than that. And I was 50, at the time, and I've already used up 9 of those 30 years. So I got some living to do. Like, I got to live for today. And then she was going over the side effects of radiation. And she was like, the affected area where we radiate, it might have the side effect of being higher and tighter. And I was like, please, can you do the other side too? Because fingers crossed on the higher and tighter.
Yeah. Oh,
but
funny.
I haven't noticed any high or anything.
Ron, has he?
Well, I haven't asked, but I'm pretty sure because they're in my shoes that they're not high or tight. Yeah. All right. Anything else on why screenings matter, or were you done with that?
I'm done with that. Those are those are the best reasons. You're going to have more treatment options or less invasive treatments.
Yeah.
You're going to, attack it earlier.
And, I think I was sharing with you, I can't remember if I just said it just now on the air, but, for my mom's cancer, there was no screening.
Right.
And I wish there was. I wish that there was a screening.
Yeah.
Because it would have been nice to have better quality of life for her and for all of us. It would have been nice to catch it before it spread.
Yeah.
But sadly, her type of cancer didn't have a screening then. I don't even know if they have one now. But let's go over this list of what types of cancers do have screenings so that everybody listening can be on board with that. First of all, of course, we're talking about breast cancer. Mammogram is the screening test for breast cancer, or one of them. And who should get it? Well, women at average risk. And when should they get it? Usually starts at age 40, and it goes like every 1 to 2 years, depending on your risk.
Yeah, and I don't know why this isn't said more often, but people who have dense breasts, especially I think it's hetero something dense breasts, they have to have ultrasounds because it will not show up in a mammogram. Certain cancers, in a mammogram, they can see dots better. I've had both, and meaning there was a time where there was like calcification that can show up in a mammogram, but like a little tumor, not so much. The ultrasound picks that up.
Yeah, if you have dense breasts, meaning that it's not just squishy, they're dense. They're more like little rocks.
I don't know. Yeah, and it's it is hard to tell because they do feel like little rocks when they're just dense breasts.
Right.
And it's hard to tell if it's like, there's been a few times I've been like, oh no, it's scary. It really is.
It is. And you should really get to know your breasts. I'm sorry, but just feel them up so that you can, what's normal.
It's funny because sometimes we'll be watching TV, Kenny and I, and then I'll have my arm back and then I'm like, I'm just doing, just
like a
breast exam while we're watching TV, and I look over at him to see if he's looking at me, and I'm like, don't get any ideas.
Nothing to see here.
Yeah.
Oh, gosh, that's funny. Okay, let's move on. Yep. Cervical cancer, there's a test for that. That's the PAP. and the HPV test. Who should get it? Oh my gosh, this chart, we got this from Chat GPT. They say who should get it? Women with a cervix. Okay, really? This is where we're at. This is what we have to do. And
what constitutes a woman? Well, if she has a cervix.
Goodness. I'm going to tell you what. The age that you're supposed to get this, it says on here, age 21, 65. So if you're listening to my voice and you are a woman with a cervix, okay, and you are age 21 to 65, and you have not had a PAP, get one. You know, I met somebody through Evelina's Red Dresser, at the store where we used to work, who she didn't know that you didn't need to get a PAP after you were done, like, you know, with your having children and all of that. She didn't know that you needed to get a PAP.
Oh.
Okay.
Yeah.
And she ended up with really bad cervical cancer.
Ooh.
And she had to have major surgery and almost lost her life. And she has to even have like all kinds of stuff now because they had to take part of her colon and whatever. Anyway, she's an advocate now for cervical cancer. She wants people to know. Check with your doctor. You need to make sure you get a PAP.
Now, which one is for the ovarian? Which test is that?
Ovarian, it says that there's no routine screening available. It's high risk only, and talk to your doctor if you have BRCA family history. The BRCA is like the genetic testing for breast cancer. So there must be some relationship to that. So cervical is with the PAP. Ovarian, talk to your doctor. And the BRCA testing is, I had that, and that's genetic, and it's pretty rare that you have a positive.
Okay. Oh, I see. Now I see this. No routines. But now what about, oh my goodness, uterine?
That one doesn't have a screening.
It doesn't. Yeah, I think my mom had precancerous cells.
Something.
Yeah, in uterine.
Yeah. Yeah, well, to my knowledge, at least this list that we have, and this is from, I don't know where it came from, some U.S. guidelines for recommended ages and cancer screening list. Let's talk about colonoscopy. Colonoscopies are kind of fun, actually.
Well, I don't know. Fun. Okay, so you get a good nap.
You get a great nap. You don't have to cook. You sit around in your fat pants. You can watch all kinds of Netflix, but you just have to pause it here and there. Anyway, it's fun for what it does, right? Everybody should be getting their colonoscopy starting at age 45. This is new. It used to be age 50.
Yeah, in some cases they say 40. That's what our, what do you call that? The gastro something doctor.
Okay.
The colonoscopy doctor.
Yeah.
Told us. Yeah.
Yeah, I think it probably depends on your history and such. And you only have to get them every 10 years, unless, like in my case, I have to go every 8 years because of my cancer history. But like Ron's case, every 10 years. And what they do with a colonoscopy, some people may not know this. I did not know when I first had to go get one. They're actually screening for the cancer, but they're looking for polyps. And when they're in there with the camera, if they see a polyp, they cut it out. So that's where it benefits you.
Yeah.
No, it's beautiful because that's a beautiful thing.
Yeah, it's beautiful, but it's gross too. It's the thought of it. Have you seen pictures of the polyps in color?
I haven't seen a picture of the polyp, I don't think. I've seen like I don't know if it's an actual picture or if it's like an animation.
Yeah. I've got some of our family records and pictures of, I can't not see it.
Okay, but do these tests.
Oh,
friends.
yeah, for sure.
Don't listen to Catherine.
Well, I'm just saying that's the reality of it.
And there is some risk to a colonoscopy because you have to go under general anesthesia.
Yeah.
And they are going into your colon with a tool. And I have an extended colon, lucky me, like your mom did. Your mom and I were so much alike.
Oh my gosh.
Basically, an extended colon means that you just have, God gave you more colon than you need. And you're literally full of you know what.
Yeah, I think they called it...
a torturous colon.
Torturous. Yeah, torturous.
They have different names for it.
Right.
But it basically means it's all twisty in there. And so for me, I can't go to like a regular doctor. I have to go to somebody who's specialized. I have to go to a specialist.
Yeah.
So And I do that because I don't want anybody doing anything weird inside my extended colon.
Well, and they can't get through. The regular colonoscopy doctors can't get through properly.
No, they can't.
So they have
can't.
to, right.
Because I tried that on my first one, and the guy was in there, and then he's like, oh, yeah, we're backing out of here because he couldn't do it.
It's tumultuous.
It was. So colorectal cancer, and definitely you want to get these screenings because you want to find this cancer early because it's very treatable early.
And it is said that the average American probably has some polyps, pre-cancerous stuff.
Yeah.
But because of our diets.
Yeah, I had a couple. They nipped them out. Now, you have a couple other options with colorectal cancer, and that's the FIT test or the Cologuard. I mean, those are like the non-invasive ones that you basically, you just take a stool sample and you put it in this tube and you send it off in the mail.
Poop in a box.
Basically, that's what it is. The colonoscopy is the gold standard of colorectal cancer
It's more
screening.
accurate.
It is. All right, let's move on. Lung cancer. There is a screening for lung cancer. It's a low-dose CT scan. It's for smokers and former smokers. So if you are not a smoker, you don't have to worry about it. If you never smoked, you don't have to worry about it. So I do not have to get one of these.
Now, what about people who lived in homes with smokers? I would think they would be at risk.
That I don't know. I would think that they would put it on here if you were a secondhand smoke victim. I call it a victim. I hated that, secondhand smoke. So I don't know. But anyway, it just says smokers, former smokers, ask your doctor about a lung cancer scan. And when to get it between ages 50 and 80 with a 20-pack a year history. So if you smoked 20 packs of cigarettes a year, so that's pretty significant. I don't think that's significant.
20 packs a year? That's not a lot.
Oh, you're right. What am I thinking?
Yeah.
Because
there are people who
do
smoke a pack a day or 2 packs a day.
Oh, my gosh.
Yeah.
I can't even imagine that.
Yeah.
Okay. Well, friends, just get on it. If you were a smoker or are a smoker, have the test or talk to your doctor. Okay. Prostate cancer. It's a PSA blood test in men age 50 or 45 if you're at higher risk. I'm sure there are people listening who need to get after somebody about that. Okay, usually it's women that listen to our podcast, but if you have a man in your life who's age 45 or 50, talk to him.
And women do not have a prostate.
Yeah, praise God.
I'm just saying. Let's not get that confused.
Oh my gosh. So I went to this prayer conference and, they were talking about prayer prostrate.
Oh, yes. Yes. Don't want to say that wrong.
It was the opposite way.
Yeah.
It was so funny. Anyway. All right, skin cancer.
Yeah.
Let's talk about it. You need to go to a dermatologist once a year for a full body check. You do that, don't you?
I do.
Why are you laughing?
Well, because the time that I went in and he's like, oh, you have a little something on your back. So then they did what they did, took it out and he said, do you want me to take a picture of it so you know where it is and what it had looked? So I said, sure. So he sends me the picture, and I was looking at it. I'm like, who's that? Who is that big person? I literally did not recognize myself. I was like, that's what I look like?
Is that Tracy? How'd she get in my back? Oh, that's funny. Okay, so
true story.
I know, and that's why I'm so glad you shared it because it's so funny. I go once a year. I know you go. I have my husband go, and we just get all the moles checked out because you want to make sure that you stay on top of that stuff.
Yeah.
It's only an annual thing, but if you see something suspicious, you want to be aware of what your body normally looks like. So if you see something suspicious, you go right away.
I'll tell you something, listeners.
Yes.
There are times where there's maybe, a spot that looks really suspicious. I mean, I look it up and, it's the discoloration and the shape. Oh, yeah, that's definitely suspicious. You get there, it ain't no thing.
It's age.
But something else that you totally would not have thought. And that is the one that looks suspicious.
Yeah.
It's really weird.
It is. That's what happened to us when we first went. because I swore that Ron had some kind of cancer or something, like he had something growing on his skin.
Mm-hmm.
Well, it turned out it was a fungus.
Mm-hmm.
And it was, there's a fungus among us. And Ron is a heavy equipment operator.
Yeah.
And he's out in the dirt. So there's a lot of fungi that live in the dirt, right?
Mm-hmm.
And so it probably settled on his forearms because that's what's exposed.
Right.
Anyway, she gave him a cream and stuff. Well, I was dragging him in there, but she noticed something on my nose
That you didn't notice.
I knew that I had something that wasn't healing. It was like scabbing, but I didn't think it was anything.
Right.
And it was skin cancer.
Yeah.
And she had to like nip it off with some kind of a dry ice, and so it burns it.
Mm-hmm.
And then I walked out of there, it looked like somebody punched me in the face.
Mm.
And once it healed up, it was fine. And
Yeah,
I've
you can see it.
so now I have to have this looked at every year, and I think I've had it treated 3 times. So whenever and she said it'll keep coming back, and you just have to keep treating it. That's all.
Is that like a basal cell kind?
I don't remember the type. It's not like super dangerous, but if you don't treat it, it'll spread, and you don't want to have to like. I had a friend of mine who had to have a big chunk of her nose like cut out.
Yeah.
And you just don't want that if you could avoid it.
Right. Okay.
All right. Moving on to oral cancer. Did you know that when you go to the dentist and they wrap that like gauze around your tongue and they move your tongue from side to side, that's what they're doing. They're doing a cancer check. They're looking
No,
for,
I did not know that.
Yeah. They're looking
It says
for,
here smokers, the ones who are at risk are smokers. They should also have on here the ones that chew, because you could get cancer from chew big time.
Yeah.
Have you ever seen?
No.
Oh, it's really
Bad.
scary. Like yeah.
Yeah, don't ever get into that. If you're not smoking or chewing, just don't. Because once you get hooked in there, I think it's hard to get out.
Did I ever tell you when Kenny
You chew tobacco?
No, but when Kenny and I were dating,
Yeah.
I'm not sure if I ever told you. We were at the mall, at Orland Mall. And I saw how like he was chewing something, like, what's in your mouth? He was chewing.
Oh my gosh.
Yeah, he used to chew before I met him a little bit.
Yeah. I don't think that you'd marry him if he was a chewer. Would you?
Well, it's hard to say.
Yeah, that's true. I guess you would.
Yeah.
All right. Pancreatic. There's no screening for pancreatic. It's high risk only, screening in clinical settings. So there's no routine screening, but I guess they can look at it in a clinical setting if you're super high risk. Liver, it says there's an ultrasound and blood test for high risk only, chronic hepatitis or cirrhosis. And then testicular, only for the men.
Self-check.
Don't give them any reason to go down there for anything. It says it's for men ages 15 to 44, monthly self-checks.
No comment.
Oh, goodness.
I have no idea what's so funny.
Anything else you want to say about screenings?
Oh,
all right.
all good.
Praise the Lord. Let's move into why we procrastinate. Catherine, why?
Yeah.
What's the story?
Unfortunately, I'm going to list these things, and they're in order of the most common reasons down to the least common.
Okay.
The number one reason is concerns about a stressful result.
Yeah, like they don't want to know.
That's right. Next would be concerns about OOP, which is, oh my goodness, I'm blanking on it, costs. It's out-of-pocket costs.
Yeah.
And then after that would be having multiple appointments. People don't want to like have the hassle of multiple appointments.
By the way, back up the out-of-pocket cost.
Yeah.
If you are listening from Illinois, I know that Illinois has a state law that your testing, your screening will be covered by the state. You have to qualify for it, so you just have to, Google it. But there is a law in our state where they will cover your screenings.
What about after that, if you're diagnosed?
Well, I think that part of it then would kick in under your regular health insurance. But let's say, for example, that you either don't have health insurance or you have health insurance that doesn't cover screenings, which seems like it would be odd to me. But I I don't know for each individual's circumstance, but I do know because my niece works in Springfield, my niece Shayna, and she was the one who told me about it.
Yeah.
That our state will cover your cancer screenings if you do not have the funds to pay for it. Now, so I would definitely encourage people to figure that out.
Right. And in terms of after the screening, I don't know either, but surely there's got to be something for folks who don't have insurance.
Yeah.
Okay. And I did say multiple appointments. Okay. After that, insurance approvals, getting covered, which, believe it or not, that is a separate category. Knowing what screenings or when and how often. Some people, when they don't have doctors that direct them in these matters, which I was like, oh wow, but it does
some
happen.
people don't even go for a wellness check.
That's true too.
So if you're not going to the doctor once a year for a wellness check, nobody's going to come knocking on your door saying it's time for you to go for this or that.
Right.
Except for us, here we are telling you.
Yeah, it's not Little House on the Prairie. After that, concerns about the procedure. So fear, you could just call it fear. Scheduling the appointments is after that, because gosh, that's just so hard. I'm being sarcastic, but then again, I do get it. Like, it's just, it's interruption.
It is.
In your life.
It is, but you have to do it. Sorry.
Yeah. So distance to nearest facility to screening is that's
a big deal in certain areas for sure.
Yeah. Transportation to the appointment comes after that. That's 28% of the people. I haven't been giving the percentages, but now that we're getting lower, I will. 28% of people taking time off of work is another reason why they put it off. 25% of people, the loss of pay while off of work. And lastly, at 14%, child or dependent care.
Well, and those are all reasons for procrastinating cancer screening tests.
Yeah.
And I get it. They're all legit because we all have our stuff. And at the same time, you've got to bump yourself up to that top priority and find a way.
Yeah, I was thinking about how when we were talking about that we care for our children, if we have children, or maybe we care for our adult parent or just others in general, and how we don't take care of ourselves sometimes, but we'll push somebody else to. Yeah. And I was thinking about the scripture that says, love your neighbor as yourself. Right. So that's a commandment, and that's saying love yourself.
Exactly, because God made you. Speaking of scripture, let's share our scripture for today. Ephesians 5:29 says, after all, no one ever hated their own body, but they feed and care for their body, just as Christ does for the church. And then 1 Corinthians 6.
And the rest of it, for we are members of his body.
That doesn't say that here in this translation, but that's why I didn't read it.
Okay.
But
well, I'm just putting it in there because that's like, to me, it's just such an important element of that whole scripture.
For sure. Then 1 Corinthians 6:19-20. Do you not know that your bodies are temples of the Holy Spirit who is in you, whom you have received from God? You are not your own. You were bought at a price. Therefore, honor God with your bodies. I love that. All right, friends. Well, that's about a wrap for content in terms of this this episode. We want to leave you with a challenge to schedule one screening today.
That's your call to action.
You're probably overdue on something, so just pick one out of that list. Not the prostate if you're female, but pick a screening and go schedule it today. Well, you've been listening to the Life Happens, Laugh Anyway podcast, and I'm still comedian Tracy DeGraff.
I'm still Cathrine.
See you next time.
Goodbye.